Okay, let's talk about the patient experience of cataract surgery. So let's chat about what it's like to go through this process. There are some people who want to know everything and then others nothing. So for those of you in the last group, here are my take-home points. Number 1, a twilight intravenous sedative anesthetic means you are awake, but the sedation will help you feel detached from the procedure, banishing anxiety and discomfort. While you may be able to respond to simple commands or questions, you may not remember much about the surgery afterward. Number 2, you will not see nor feel any of the surgery taking place. The lights in the microscope flood the eye with light, often creating a fascinating light and colour show. Number 3, you do not need to hold the eye open for the procedure. We'll use an instrument for this. Number 4, you will have an eye shield over the eye until the following morning, which will be removed when you wake up. You should already notice an improvement in your vision. Number 5, the eye can be gritty and watery for several hours after the surgery, which is mostly gone by the next day. Sometimes Panadol is required, but generally nothing stronger. Number 6, you will have guidelines and instructions to take home with you and what to do after the surgery. Number 7, I'll call you the next day to see how you're going, and then we see you face to face in the next 1 to 2 weeks. Okay, let's go through that in some more detail. The day of surgery. You will be given instructions in the days before on what time to present to the hospital and when to fast from. In general, if you're having morning surgery, you'll fast from midnight the night before. If your surgery is in the afternoon, you can have an early morning breakfast, but before 7 a.m. and then fast. We will ask you to take all your normal medications with a sip of water, including blood thinning medication. The only exception will be some diabetic medications that should be reduced or withheld when you are fasting, which we will discuss individually. Expect the whole hospital stay to last between 2 to 3 hours. You'll need someone you know to take you home and must have someone who is with you the first night, as you've had an anaesthetic. There will be some admission paperwork on arrival, and a nurse will check all your important details. At each stage along the way, you'll be routinely asked who you are, do you have any allergies, and what you are having done and which eye. This might create the impression we don't know what's going on, but rest assured we are carrying out all these important checks at every stage of your admission and surgery to eliminate the chance of any mix-up. After admission, you will wait in the pre-operative anaesthetic bay, and drops will be given to the eye for surgery to dilate it and to numb it. Your anaesthetist will meet you here, review your general health, place an intravenous catheter in your arm, and plan and explain to you your anaesthetic. I will also see you in the anaesthetic bay before we go into theatre to make sure you're okay and see if you have any questions or last-minute concerns. It's very important for me to reconnect with you again before the surgery. It focuses me on why we are doing this for you. The vast majority of cases will be done with topical anaesthetic and intravenous twilight sedation. This means we only use drops to numb the eye and combine this with sedative and pain-relieving medication in the intravenous drip. This is probably the most important message of this video. A sedative anaesthetic is different to a general anaesthetic. You will be awake for the procedure, but it won't be how you might imagine it. As the sedative takes effect, you will start to feel more relaxed and drowsy. Some patients describe the sensation as being a twilight state between being fully awake and asleep. The sedation will help you feel detached from the procedure, eliminating anxiety and discomfort. While you may be able to respond to simple commands or questions, you may not remember much about the surgery afterward. Even if you don't remember anything, we carefully monitor you to make sure you're okay and address any issues. We make sure you're in this sweet spot before anything is done. This is my second most important piece of information. You will not see or witness the surgery occurring. Once you are wheeled into the operating suite, you may be aware of quite a few people. Apart from me and your anaesthetist will be my assistant, the anaesthetist assistant, the scrub and scout nurse, and orderly, often up to 7 people, all there for you. You will be carefully positioned on the operating table with your head lying flat. We will make sure your neck and back are comfortable and well protected. Usually, a pillow is placed under your knees and an oxygen mask on your chin. After a final check of who you are, what surgery we're doing, any allergies you have, and the lens for the surgery, the anaesthetist will start to be putting in the anaesthetic into the drip, and it'll start taking effect. I will gently wash the eye, which is now numb, with betadine to sterilise the area before placing the surgery drape over the eye and face. I will then make a small window in the drape and insert an instrument that will keep the eye open for the procedure, so you do not have to worry about blinking or keeping the eye open. As I bring the operating microscope over the eye, the vision will be flooded with light, and you are likely to see 3 different objects, which are the lights in the microscope. I will ask you to focus on those lights throughout the case. Most patients then report what seems like a light show, and then before you realise, the surgery has been completed. It is now that waves of relief and sometimes subtle wonder about what just happened will waft over you. Out to recovery, something to eat and drink. The recovery nursing staff will make sure all is okay, and you'll be discharged home in the care of your family or friend who is taking you home, with guidelines and instructions and emergency contact details just in case. The eye is often gritty and can be quite watery for the first few hours. Take Panadol if needed. On waking the next morning, sometimes the eye is stuck together. Remove the eye shield, gently wash the eye with clean, cool water to allow it to open. Most of the grittiness will have gone, but there can be some that persist for a few days or a week or 2. The vision is often better already, but can take some time to get to its best after the surgery. I will call you the day after the surgery. If you have had the drop-free surgical technique, you may notice a white bubble sitting below the eye inside the eyelid. This will slowly dissolve over the next 1 to 2 months. There can be some minor bruising of the eye and or swelling of the clear conjunctiva, which should get better quickly in a few days. If you have been prescribed drops or lubricants, use these as directed. Read the post-operative guidelines carefully. It covers the most commonly asked questions after your surgery. If something is not quite right though, we always want to be contacted. Hopefully that gives you an overview of what to expect. Just keep in mind that each patient's experience will be a little bit different. And believe it or not, there will even be differences between the 2 eye surgeries for the same patient. But we want you to know that we are on your team. And although it will be unique for you, we have been here before with hundreds of patients. Thanks for your attention.